A lot of you chiming in. Keep chiming in. Let me know where you're from. And as always, if you don't subscribe, make sure that you subscribe. Just hit the subscribe button, whether you're listening to us on our Facebook channel or on our YouTube feed. You can hit that subscribe and make sure you sign up to get the notifications for when we do go live on these Mondays. Most Mondays, every Monday at 6 p.m. and that's Central Standard Time. You can also go over to glutenfreesociety.org if you haven't already signed up for our free gluten-free survival kit. You'll get that plus so many other really valuable pieces of information to help you improve your health and move your health in the right direction. So just glutenfreesociety.org and sign up for that gluten-free survival kit. You can also check us out over at drpeterosborne.com, where we've got more nutritional information for you to tap into and take advantage of. And if you don't already, if you haven't already read No Grain, No Pain, make sure you pick your copy up. We want all of our audience, all of our listeners educated as a fundamental starting place before we dive into some of these more deep topics. So again, today we're going to be talking all about hair loss. So many people struggle from this, and there's men and women alike. This is an equal opportunity destroyer, hair loss is. I've seen a number of different types of cases of hair loss, so understand it's important to kind of first of all know what some of the main types of hair loss are. There's your traditional male pattern baldness, and so this is oftentimes thought to be inherited in men, particularly where there's no ascertainable nutritional reason as to why the hair loss is there, but there's a recession of hair as they age, and it happens sooner as opposed to later. But then there's also hair loss, and what we're really going to be talking about are the hair loss issues that you can really do something about. We can have autoimmune hair loss. And so if you've ever heard the term alopecia areata or alopecia universalis, these are types of autoimmune hair loss where the immune system actually attacks the hair follicles, creating a random type of hair loss, and that can happen in big nummular coin-like patches across the head and scalp. It can also happen on the legs. Many people develop polished areas on the legs where the hair dissipates and what's left is just very smooth skin, almost as if you'd shaved the skin. These are forms, again, of autoimmune hair loss where the hair follicle itself is destroyed by an aggressive immune system attack. And then we also have other forms of hair loss, and I'm going to clump these into hormone-induced hair loss. So hormone abnormalities, and then we can also have another form of hair loss which has more to do with nutrition. So malnutrition specifically. So malnutrition-induced hair loss. So these are going to be some of the primary types of hair loss that we're going to talk about tonight. And let's just dive right into autoimmune hair loss, because I want to share with you, one of the things I really wanted to share with you tonight was a case study. Because I see women all the time, they come to see me and they have this horrific autoimmune alopecia. And alopecia areata, again, it's that coin-like hair loss. And I'm going to pop a picture up here on the screen for you to check out, because I really want you to see how aggressive it can be. Now, the picture that you're looking at, this is an example of a gluten-induced autoimmune hair loss. When this woman came to see me, she actually had a prior diagnosis from her other physician, from her other doctor, as alopecia areata. And they had done multiple types of treatments. One of the treatments for alopecia areata is the injection directly into the scalp, an injection of steroids to try to calm down the inflammation. In essence, to try to calm down the immune system, because steroids suppress the immune system. So the hope was that injecting the steroid in the scalp would lead to a regression of hair loss and potential return of the hair. In this particular case, it didn't lead to a regression at all. The steroids actually didn't work, and they only served to contribute to greater hair loss. So in autoimmune hair loss, again, in this case, one of the issues that commonly is present, actually, let me use the right color here. One of the common things that happens is can be gluten-induced. Gluten can induce an autoimmune hair-like pattern, and actually in this case gluten was one of the main reasons why the hair loss occurred. It was a gluten sensitivity, a major gluten sensitivity type of reaction that actually induced the autoimmune response that was leading to the massive hair loss. It only took about 5 months. You can see in the picture in the before and the afters, there's a 5-month time lapse in that photo, and that is the first picture is eating gluten, and then the second series of pictures is not eating gluten for 5 months, and you can see about 80 to 90% hair growth return, meaning this is a reversible condition. And a lot of doctors will tell you it's not. A lot of people will go on and they'll just continue to accept hair loss. And for women especially, this can be very, very devastating. When you have that type of mass patch hair loss coming out, it requires wigs or hair pieces or extensions to be put in, and lots of immune suppression types of treatment. I just want you to know this is a reversible condition, and oftentimes the linkage is autoimmune induction as a result of gluten exposure. So if you've got alopecia areata, men or women, because I've seen it in both, it's not just going to affect women, but it tends to bother women more than it does men. Some men wear bald really nicely, but no women that I know of have ever wanted to wear bald and be happy about it. So again, gluten induction. So get tested for gluten sensitivity. Now in the past we've talked about how you properly get tested for gluten, and you've heard me say that genetic testing is really the only accurate way to assess whether or not going gluten-free is going to be the right move. So if you've had testing for celiac disease, for example, which remember all people with celiac disease have gluten sensitivity, but not all people with gluten sensitivity develop celiac disease. So celiac testing is not accurate for gluten sensitivity. Celiac testing is only accurate for celiac disease. So you want genetic testing because the genetic testing tells you whether or not you have the genes that are going to react to gluten when you expose them to gluten. So it's very, very important that if you're trying to figure this out and it's an autoimmune hair loss, that you use genetic testing to get the answer one way or the other, whether or not gluten is going to be helpful. Now in this particular case, I want to be clear, so that picture that you're looking at, it wasn't just gluten. There were other issues as well. So when she came to see me, gluten was a major issue, but some of the other things that happened, and these fall under the malnutrition category, is this particular case, there was protein malnourishment. Certain amino acids were low, and overall protein levels were not adequate to sustain, and I'm going to talk a little bit why that's important in just a second. In this case, we also saw vitamin C, and we saw vitamin D, and so vitamin D deficiency, and there was actually even manganese deficiency in this particular case. So again, manganese being a mineral, very important for hair growth. A lot of the minerals and trace minerals and ultra trace minerals are important for hair growth, but vitamin C and vitamin D also important for several different reasons. And let's just kind of back up and talk about why these things are important, because many of you are not doing this adequately enough. There's an old saying with chronic illness, and it doesn't matter what your chronic illness is, and that saying goes like this: everybody is entitled to more than one problem, meaning it's very rare that we see like a smoking gun reason that somebody develops illness. Usually it's a multitude of different factors. It's not just one thing, but it's a multitude of different things. And so in this case, gluten was a part of the equation, but these were other parts of the equation. That's what I mean by more than one problem. You can have gluten creating an autoimmune condition, the autoimmune condition putting stress on protein stores, which basically the protein is being used to fuel the immune system, which is in effect killing the hair follicle. So without adding more protein, we basically the body is stealing protein from the hair or from the potential for hair growth to feed the immune system to fight the war. And we don't want that. Obviously, we want to get rid of the war, but we also want to resupport the person's nutrition by getting them adequate protein. And so again, protein, it's chicken or the egg. In this case, chicken and the egg, it doesn't matter because you have to address both the chicken and the egg. So the autoimmune condition can cause a disruption or a depletion in protein because the immune system's driving protein it's basically sequestering protein to use in the war. But the other thing is that the person, in this case, it was also dietary protein was not adequate enough. And so when dietary protein is not adequate enough, hair growth is going to slow down and cease. So this sometimes one of the most simple things that a person can do is make sure they're getting adequate protein. So if you are struggling and you're trying to figure out how many grams a day of protein should I take in order to at least make sure that my hair loss is not being caused by protein malnourishment, kind of a general rule of thumb, and again, general rule of thumb, these are not perfect numbers, it's 0.8 grams, so 0.8 grams of protein per kilogram of body weight. So in order to get your kilograms in body weight, you just divide your pounds by 2.2, and that'll give you your kilograms in body weight, and multiply it by 0.8. And if you're hitting that number, so for example, if you're 100 pounds, you divide that by 2.2, that's roughly going to be somewhere in the 40s. 40 times 0.8, you need about 36 to 40 grams of protein in a day. Again, I did that math in my head, so it may not be 100% accurate. Get out your calculator and do the math. But again, 0.8 grams per gram or per kilogram of body weight of protein on a daily basis, meaning every day, not once a week. I see this a lot. This happen a lot. This protein-induced hair loss will sometimes happen in people who are following a vegan diet. So it doesn't mean all vegans have hair loss, but I do see this pattern in people who are not getting adequate protein, and that generally as a diet restriction, that's the vegetarian or particularly the vegan-based diet where protein is not being consumed in a high enough quantity to help with hair growth. So again, it doesn't mean all vegans have hair loss, but it certainly, if you're a vegan and you're losing your hair, that's the very first thing I would have you do is make sure you're counting your protein in grams on a daily basis, make sure you're getting adequate resources to be able to grow that hair. So remember that protein helps to form the collagen backbone of your hair, as does the vitamin C. The protein and the vitamin C actually work together to help form the hair follicle, not the hair follicle, but to help form the hair, the protein of the hair itself. So very, very essential for that process. Now, interestingly enough, autoimmune disease also can disrupt vitamin C levels because you use more of your vitamin C on a daily basis to fight the inflammation from the autoimmune process. Same thing with vitamin D. So hopefully you're seeing this trend here, is that the inflammatory process caused by an autoimmune condition can lead to your body using or utilizing more of its internal resources to try to deal and cope and manage with that inflammation. So utilizing up more protein, more vitamin D, more vitamin C, in this case, it's a byproduct of the autoimmune condition itself. And so the autoimmune disease starts to fuel the malnutrition. And when you find out what's triggering the autoimmune disease, oftentimes you still have to address the malnutrition because the malnutrition doesn't correct on its own. So, okay, let's see here. We got more of you chiming in. We got Donna again from Katy. Welcome, Donna. And Wanda from Tennessee, and Hetty from Arizona, Tucson, and Bob from Wyoming, and Laura from Canada, and Marianne from Colorado, and Luann from California, Palmdale, and Cheryl from New Jersey, and Lori from Kentucky. Welcome, folks. Welcome to the Pick Dr. Osborne's Brain Show. Look, if you know somebody who's going to benefit from this information, don't be stingy. Please share this feed with them. Let's help more people together. Remember, our mission here at the Dr. Peter Osborne camp is to help 100 million chronically sick people find real meaningful answers to their health issues. We got Maria from El Paso. Let's see here. Lisa from Miami. Edward from Lamont, Illinois. Peruz from Los Angeles. Okay, so lots more of you chiming in. I got a question I'm going to answer because I talked and I hammered on this one, which is what the question is coming in from Teresa, and she's asking which genes are responsible for gluten sensitivity. That's a great question since I mentioned it. And if you go to glutenfreesociety.org, there's a big tab at the top of the page. It says genetic testing for gluten sensitivity. You can learn more about genetic testing, but the genes are HLA, DQ, alpha 1, and DQ beta 1. So it's two separate genes that generally we measure. Now, sometimes you can get these genes measured for what are called DQ2 and 8 patterns. But these are celiac patterns, and so many people have gluten sensitivity genes that are not celiac patterns, and so you want to get all the patterns on these genes measured, not just the 2s and 8s. And most of your labs like 23andMe and some of the other genetic testing services that are out there only measure these 2s and 8s. So if you don't have them, you don't know whether or not you have non-celiac gluten sensitivity genetic pattern. And it's very important to discriminate that difference. Because if you don't know and you're told that you can eat gluten safely and you're still gluten sensitive, it could, that potentially could send you on the wrong path for a long time, making you sick or stay sick. Okay, let's see here. Great question. And again, those of you who have questions, if you want to have questions about again, tonight's topic is hair loss, and we might take a few deviations. But fire away. Let me have your questions because I want to make sure I can get them answered from you. Lynn's chiming in from South Australia. So it looks like tonight we've got South Australia, we've got Thailand, we've got Canada, we've got South America, and we've got a number of the central U.S. states all represented. So this is super awesome to see so many people in so many places tuning in and getting this message. So thank you for sharing where you're from. Now, I'd like to just do a quick poll with you guys as well. I love polls, and polls give me feedback on how to help you. How many of you currently listening tonight struggle with some form of hair loss? Again, doesn't matter whether it's autoimmune hair loss or any type of hair loss. If you struggle with hair loss, go ahead and just type in a 3 in your box. Just type in 3 and let me know whether or not you're struggling with hair loss. And we'll keep talking about it, but I'd like to know how many people are actually dealing with this type of problem. Okay, let's see here. We got Renee from Nashville and Gloria from Kansas City. Okay, lots of folks chiming in 3s with hair loss here. So yeah, just keep answering. If you're struggling with hair loss, just let me know. Marsha's asking, have you heard of natural progesterone causing hair loss? Yes, it can. Now, one of the things that can happen if you're taking, and this is where it goes back to hormone abnormalities. Maybe it's a good transition to go in and start talking about hormone abnormalities. But hormone abnormalities, and this can be generally where we'll see hormone abnormalities, is in blood sugar dysfunction. And you may be saying, well, what does that have to do with hormone abnormalities? Blood sugar dysregulation typically leads to an imbalance in testosterone and progesterone, but also in insulin, which is a hormone. A lot of people don't realize or don't think of insulin as a hormone, and that insulin, this is one of the things that happens is when the blood sugar is too high, it will create a hypertestosterone scenario or a hyperandrogen scenario where women can actually start to grow facial hair but have hair loss on the scalp. So this is, again, this is a form of diabetes. If you've ever had a diagnosis of PCOS, polycystic ovarian syndrome, it's a form of diabetes as it affects the ovaries. If you've ever been diagnosed with diabetes or hypoglycemia, this is something you want to consider. Now, from that perspective, from that hormone imbalance perspective, gluten can become an important piece because, as you've maybe heard me talk about before, gluten can be a major hormone disruptor, but other things can disrupt hormones as well. And a lot of them actually are food-based triggers. So sugar being one of the big ones. If you're eating a lot of sugar, a lot of processed sugar, this is a real easy way to get to hair loss for several reasons. Processed sugar will drive up insulin. Insulin being driven up will then impact cortisol, which is a hormone. And cortisol is a catabolic steroid, so it causes breakdown. And this breakdown leads to you, again, mobilizing your protein to do other things than build hair. Your body is trying to stabilize the catabolic scenario. So, again, processed sugar can lead to increased insulin, increased cortisol output, which is an increased breakdown fundamentally in your proteins, and that makes it harder for you to grow hair. It's a very, very common side effect. But sugar also puts the immune system under direct stress. So the immune system stress, remember, the fuel for your immune system is protein.
Breakdown fundamentally in your protein.
And so if you're burdening your immune system with your food, remember, why are we eating? We're eating to nourish the body and to nourish the immune system, not to create a reason for the immune system to be overutilized. And so if you're eating foods that can trigger an immune system response that's going to mobilize your protein to basically help you in that immune system response. So a lot of times we'll see hair induced as a result of processed sugar. We can see it as a result of processed dairy, processed grain. Virtually most processed foods in and of themselves that can create an immune response that, again, mobilize your protein away from hair growth can create or can trigger an issue with hormonal imbalanced hair loss, but also with malnourishment, because many of the processed foods don't have the vitamins, the minerals, the nutrients that are necessary to help you, again, build and grow new hair. Now, the question was, can natural progesterone cream actually do this? And the answer is yes, particularly if you have some genetic variations in your ability to metabolize. Remember, progesterone has many different pathways, but one of the pathways for progesterone is to help you produce cortisol. One of the pathways of progesterone is it can convert into testosterone, and one of the pathways for progesterone is it helps us get to estrogen. So progesterone is actually kind of a key central hormone in the body's process of trying to get to testosterone, estrogen, as well as cortisol. So overdoing it, and this is where even if you're taking a natural, like a yam-based progesterone cream, it's very, very important if you're doing any of those things that you monitor your progesterone level and don't just take it indefinitely just because. You want to make sure you're monitoring it, because too much of a good thing becomes a bad thing, and some women need that progesterone, and there's nothing wrong with that. But again, if you're not having it monitored, if you're not looking at the level periodically, you can sometimes overdo it, and that can lead to hair loss as well. Okay, good question. So we got Renee from Nashville, and let's see here, Angela from Rochelle, Texas, right in my backyard. Lots of people. Okay, I'm going to talk about this one because this is one of those that commonly doesn't get called hair loss, but it's related to hormone dysfunction. And let me see here. We need our pink color here. So one of the problems with hormone dysfunction is low thyroid or high thyroid, but for most people, low thyroid or hypothyroid. Low thyroid, one of the common symptoms, one of the most early presenting symptoms of low thyroid is loss of the lateral eyebrow hair. And somebody mentioned eyebrows in the feed, and I want to just bring this up. So if you're losing your eyebrows from the outside going in essence, you're losing that lateral third of your eyebrow hair, this is a major sign of low thyroid. Now, low thyroid in and of itself can cause hair loss, not just the eyebrow, but a lot of women that are, you don't have, so I said earlier that autoimmune hair loss, it was patches of hair where the skin becomes shiny, like that image I showed you. But there's generalized hair loss where the hair is just coming out in big clumps, but it's not leaving complete bald spots. It's just thinning, and it's not growing in as fast as it's falling out. This is typically either hormone-induced hair loss or it's nutritional deficiency-induced hair loss, meaning if you've got hair growing in slower than it's falling out, you've got one of those two problems most likely. And low thyroid is one of the more common causes of thinning of the hair. Now, there are a lot of things that can create a low thyroid. There's nutritional thyroid disease like iodine deficiency. You also can develop low thyroid as a result of vitamin C deficiency, iron, vitamin D, selenium, vitamin A deficiency. Those can all create or contribute to nutritional hypothyroidism. But then so can food. Food can contribute to, but more specifically, autoimmune hypothyroid. So something called Hashimoto's disease, which one of the biggest food factors associated with Hashimoto's is gluten. And so we can get gluten inducing a Hashimoto's. In that picture, in that case study I showed you, that was actually part of the problem too. It was gluten-induced alopecia areata, but it was also gluten-induced hypothyroidism. So the gluten was affecting that person in two ways. One, it was creating an autoimmune response against the hair follicle. The other, it was creating an autoimmune response against the thyroid gland. And so we were getting not only hair loss in those patches, but we were getting hair thinning all the way around the block. So the hair was thinning and we were getting patch loss. So again, going back to you're always entitled to more than one problem. There can always be more than one type of illness or more than one type of problem creating those illnesses. And illnesses are an equal opportunity destroyer. So in that case, TPO, thyroid peroxidase, which is an antibody test that you can ask your doctor to run. So if you've got a low thyroid, there's actually an antibody test. You can have them measure what's called your TPO. You can also have them measure what's called your anti-thyroglobulin antibodies. I abbreviated that as ATGA, anti-thyroglobulin antibodies. Both of those can be measured to try to help you determine whether or not there's an autoimmune process attacking the thyroid, which might make you suspect things that create autoimmune disease like gluten sensitivity or other food allergies or chemicals or infections. Remember, there's 4 big triggers for autoimmunity: nutritional deficiency, infection, food, and chemical triggers. So testing, if you have autoimmune disease, testing for those 4 triggers always becomes an important aspect of trying to figure out why the illness is there. Okay. So Angela is asking, what are my feelings on 100% grass-fed whole dairy? Angela, I want to refer you back to youtube.com/glutenology and type in dairy versus gluten, and you'll get the answer to that question. I did a whole show on that topic, and I don't want to minimize the importance of that answer by not giving you the in-depth on it. Tracy's chiming in, no hair loss since I got my thyroid straight. That's awesome. Okay, let's see. Yep, thinning hair with clumps falling out every time I brush. That would be a surefire way to either one, I mean, in my experience, and this is Cheryl, is to check your protein levels, your amino acid levels, and check for hypothyroidism, autoimmune hypothyroidism. Okay, let's see here. Yeah, so this question's coming in. Looks like on blood sugar. Huda's asking, she thinks she has diabetes. Blood sugar before sleeping was 135, even after 8 hours of not eating. Then as she woke up, it was 161 and increasing to 169 by noon, all without eating anything. What's the explanation, and how come after exercise blood sugar goes up too? There's a hormone imbalance there, Huda, and that's really, you've got to have that addressed. And hormone imbalances with blood sugar like that going up and down, hormone imbalances, you could have an insulin sensitivity issue where your insulin is not, you're producing it adequately, but your insulin receptors are not receiving the insulin, so the blood sugar is trapped in your bloodstream and can't get into the cell. I actually have a couple of videos explaining this. Again, go back to youtube.com/glutenology and type in blood sugar problems, and you'll find some videos on that. But one of the #1 reasons that can happen is chromium deficiency. Now, chromium deficiency can also cause hair loss. Chromium deficiency is notorious for creating blood sugar disruption. So what happens is chromium's nickname is GTF. So if we're going back up here, chromium, GTF stands for glucose tolerance factor. And on the surface of your cells, let's see if I have room to draw here, you have these antennae that stick out, and they're called insulin receptors. So if this is a cell, and that insulin receptor sticks out like this, that insulin receptor is made out of chromium. And if you don't have adequate chromium, you won't form enough insulin receptors. So you can make plenty of insulin. If insulin comes in here and it docks into that, what it does is it sends a message to the cell to open a doorway so that sugar can come into the cell, or glucose can come into the cell and make energy. And if that's not happening,
Sends a
and if that
message to
door's
the
not
cell to
opening,
open
that
it.
sugar stays in your bloodstream. So instead of getting into your cell, it stays in your bloodstream, and your sugar's going to ride high all day long. Now, one of the other reasons that happens is stress. There are a lot of reasons we can become insulin resistant, and stress, chronic stress is one of them. Another reason we develop insulin sensitivity is chromium deficiency. That's the nutritional reason why, one of the biggest. Another Another reason why is niacin deficiency or vitamin B3. And niacin, which I talked about last week, niacin helps chromium produce that insulin receptor. So again, a combination of chromium and niacin that produce that insulin receptor that helps sensitize your cells to the insulin so that the door on your cells can open and receive the sugar, because that's how we make energy. We get that glucose into the cell and we convert it into ATP, which is what the body uses for its source of energy. But by getting the sugar out of the bloodstream, we keep our sugar regulated in the bloodstream. Otherwise, that sugar stays in your blood. It stays at higher levels. And sugar, just like if you spill it on the floor, you can spill sugar on your proteins and on your hormones. And when you basically have too much sugar in your bloodstream and it coats your proteins and your hormones, it makes them sticky. They don't work as well. So even you could be making the right quantity of hormones and making the right quantity of neurotransmitters and other chemicals, proteins in your blood. But if they're coated in sugar, they won't work as well. It will dampen their response. So if you're measuring the hormones and they appear normal, measuring blood sugar might be another good step for you to see whether or not blood sugar is impacting those. Okay, let's see here. Okay, so here's one. Cheryl says, my thyroid is corrected with Synthroid and my blood levels test normal, but I still have eyebrow loss. Well, if you have Hashimoto's, if your thyroid is a Hashimoto's condition, you should know that Synthroid contains corn. And many people, many women particularly, are taking Synthroid, prescriptive Synthroid, and they're gluten sensitive. And one of the reasons they have a thyroid problem is because they're gluten sensitive. And so they're eating or taking a medicine every day that contains a form of corn. And a lot of people don't realize this, but corn has gluten in it. Newsflash for those of you who are new. If you want to learn more about corn and gluten, you can read No Grain, No Pain. There's a whole chapter on that topic. But corn has gluten in it, and you're taking a drug to treat a disease that's actually caused by gluten, and the drug has gluten in it. So although you might feel better and correct your thyroid level, you won't correct the underlying autoimmune problem that's actually being induced by the gluten. So you have to be careful and read your labels on all of your medications if you're taking them to make sure that that you're not doing something good and bad at the same time. Okay, let's see here. Okay, this is a great question. What is normal hair loss? So Marianne's asking, I have thick hair, but when I wash, I get about a 50-cent size clump on my drain. Is this something I need to watch or be concerned with? I have no hair on my arms, but a little on my legs. So no, that quantity of hair loss when you're washing your hair, it goes down the drain, that's pretty normal. So that's not what we would call aggressive hair loss. Where it becomes aggressive if you're losing that much every day, but the hair's not growing back in. So you can have a normal quantity of hair loss, but if you're not growing hair, over time your hair will thin. But that coin size amount of hair loss in the drain is pretty normal. If you're losing 3 or 4 coin sizes of hair in the drain, that's not normal. That's a little bit more aggressive of hair loss. Is there a form of Synthroid without corn? Yeah, you can ask your doctor to write you a compounded prescription where in essence they just basically write the prescription and you fill it at a compounding pharmacy where they create it and encapsulate it for you where it doesn't have the corn fillers. There's also Tyrosint, which is one brand that's actually corn free as well. So, again, when it comes to medicines, do your diligence. The way you know whether it has corn or whether you have it, for number one, you can go to glutenfreesociety.org. On the home page, there's a box about halfway down that said what to avoid, foods to avoid. If you click on that link, it will take you to a page that lists all the hidden names for gluten. Okay, very important page. You can print that out. It's free. It's a resource for you. We created it just for you guys. And one of the links on that page, when you see corn on that page, if you click it, it will show you all the hidden names for corn, because corn has a lot of hidden names too. And so what you're going to do is you're going to take those two lists and you're going to cross-reference them with your medication. So you can go and ask the pharmacist to print out the ingredient list for your medicine. And the ingredient list you're really looking at is the inactive ingredient list. The list that reads inactive ingredients, that's where you're going to find the fillers, the potential for gluten, the potential for corn-based fillers, etc. So you just want to make sure that you have both of those and you can cross-reference. Because I don't want to, the problem with medicines is that sometimes the ingredients change. So last time I looked at a bottle of Synthroid, the Synthroid itself had a corn derivative in it. But that may have changed. I know that hasn't changed. But there are examples where pharmaceutical companies will change the ingredients from time to time. And again, this is why it's always important that if you're using a medicine, you have due diligence to cross-reference that inactive ingredient list, if you're gluten sensitive, to the different hidden forms or known forms of what gluten can be, so that you don't end up, again, getting yourself in trouble. So let's see here. I wanted to talk, there was a couple of other things I want to talk about, because I talked about nutrition, I talked about protein and vitamin C and D deficiency and manganese, but one of the nutrients that's really very important and very critical for hair loss, and sometimes we'll see deficiency of, is biotin. And I talked a little, again, this is a B vitamin, I talked a little bit about this last week, B8, biotin, and this is oftentimes referred to as the hair, skin, and nail vitamin. And it's because it's essential for the growth of the protein that forms your hair, your skin, and your fingernails. So again, biotin deficiency is also extremely common. This deficiency can actually lead to a form of skin inflammation called seborrheic dermatitis that can also inflame hair follicles and create subsequent hair loss. So there are a number of reasons why we might see a biotin deficiency contribute to hair loss. So nutritional deficiencies, very common, very easy to test for. Again, this goes back to if you're losing hair and you have an unexplainable reason as to why that's happening, have your doctor measure your vitamins, your minerals, your proteins, your amino acids, and have your doctor also run blood sugar, particularly analysis of your insulin and your cortisol levels. You can also have them measure your testosterone, your progesterone, and your different forms of estrogen, because you make more than 3 types of estrogen, but there are 3 primary types that should be measured first. And then have your doctor, if you have an autoimmune disease, or if you don't, have your doctor measure your thyroid if you don't know, right? And measure for the antibodies to your thyroid as well, just to make sure you're ruling out the autoimmune thyroid condition, because this is one of the most common conditions for hair loss today. And then if you have autoimmunity, make sure you get genetic testing done if you're trying to rule out gluten sensitivity. But subsequent to that, you want to look at other foods, because gluten is only one food of a spectrum of different food proteins that can trigger an immune response that can lead to chronic hair loss. So if you're really wanting to be thorough, you're going to measure those things as well. Now, one other really big common reason that I'll see hair loss occur is people who are suffer with chronic infection. And I didn't write that on the board earlier. Let me get a different color for you. Chronic infection, this is a bad marker. We need a new red one. Chronic infection, basically, and where this might be, where we might see somebody like this would be somebody with chronic Lyme infection, like Lyme disease, or chronic yeast overgrowth, or Klebsiella, chronic Klebsiella type of bacterial overgrowth. Chronic infection, and this is not the fever, this isn't the cold and the flu that I'm referring to. It's chronic. It's a type of infection that just continues to suppress and pull immune resources. And so the body is chronically trying to battle and trying to fight. Epstein-Barr virus is an example. Mono is an example. Different forms of staph infection in sinus infections. If you struggle with chronic upper respiratory infections or chronic sore throat, these are kind of hallmark signs of chronic infection. And so you want to actually have that ruled out as well if you're struggling with hair loss. And you have a chronic infection, know that can create that. Because again, with chronic infection, it becomes an issue of the body only has a finite set of resources to use on a given daily basis. If it's using up all of your protein to produce antibodies to help fight a war against an infection or a food, then there's very little left for hair growth. And remember, hair, although it's important, hair is less important than your body's ability to produce antibodies to help it fight. Hair is not going to help you fight that infection, but the antibodies will. So your body has to prioritize. So it's going to prioritize taking the protein and utilizing that to produce antibodies, as opposed to taking that protein and utilizing it to grow hair. So keep that in mind. If you've got chronic infection, if you've got hormone imbalance, and this can be measured, if you've got nutritional deficiency, and that can be measured, if you've got blood sugar disruption, and that can be measured, if you've got autoimmune disease, and that can be measured, and gluten sensitivity can be measured, infection they can all be measured. So if you're struggling and these things haven't been measured, you really got to take this information, go have a good conversation with your doctor, see what they're going to be able to do for you in terms of actually objectifying whether or not these types of issues are creating your chronic hair loss. And we're going to spend a few more minutes here and answer up the last few. Well, we got a lot more than a few questions coming in. But and let's see here. We got 2 feeds going here, so I'm going to try to give love to everybody tonight. So here we go. So Kadia is asking, can one heal from peripheral neuropathy due to being vegan? Can the nerve damage be healed? Is a B12 deficiency an autoimmune illness? Love from Jamaica. So we got somebody from Jamaica, from the Caribbean. So to answer that question, yes, you can heal a peripheral neuropathy with vitamin B12 if the vitamin B12 is actually what's causing the peripheral neuropathy. So now gluten sensitivity can cause an autoimmune disease that can damage the stomach, that can create a vitamin B12 deficiency, but so can a vegan diet. So this is where, again, where if you're a vegan, look, some people are better suited for veganism, but if you are one of them, it's just important to measure your vitamin B12 levels periodically, because that is one of the biggest problems in vegans as far as nutritional problems. It's developing vitamin B12 deficiency that contributes to nerve damage over time, and it's slow and subtle, insidious onset type of damage. It's not like one day you developed a peripheral neuropathy all of a sudden. It's a slow, steady progression toward the direction of that neuropathy. So yes, it can be healed, but you have to, again, I'm a big fan of measuring. Without objective measuring, it's very, very hard to know. You could be speculating. You could be vegan and have a neuropathy, and it's not because of a vitamin B12 deficiency, but it's because of something else entirely. So make no assumptions. Get the measurement done first. Okay. Let's see here. So another one coming in, and this can't be your real name. If it is, I gotta laugh. Juju Bunny Bee. So just having hair shedding, no bald spots, is this a nutrition issue or a vitamin issue? Yeah, probably. If you're having aggressive hair shedding, look, it's not so much hair shedding. Hair shedding can be a sign. So let's back up. Hair shedding, meaning you're losing more hair, even if your hair is growing normally, it could be because the quality of your hair isn't strong. The quality of the collagen fiber itself, so when you go to brush it or wash it, more of it's coming out. And that a lot of times is nutritional issue. It's things like protein and copper and vitamin C. These are necessary to form the matrix that makes your collagen, the hair structure, strong and elastic and much harder to break down. So yeah, it very much could be a nutritional issue. So Susan says, my daughter's on progesterone only pill for heavy periods, thinning hair and back acne. Any thoughts? Yeah, she's probably converting. If she's got back acne, she's probably converting that progesterone to too much testosterone, and that's going to create a different problem. If she's on progesterone for heavy periods, you got to ask a different question, which is, why are the heavy periods there? Do a full hormone workup on her. Have her doctor measure estrogen and testosterone and progesterone, but have her measure of estrogen, have her measure estradiol and estriol and estrone as well, and also have them measure something called sex hormone binding globulin. You want to ask for that one as well. And that's where I would start, along with a nutritional workup, because many of the nutrients, particularly the B vitamins and magnesium, play a role in the metabolism, the proper metabolism of progesterone and the conversion of progesterone to estrogen and testosterone. So there could be some nutritional deficit issues that are playing a role in that imbalance in the way that she might be creating or converting her hormones. But definitely you want to measure those things as opposed to just saying, let's try. Again, I don't know if that's what you did, Susan, but that's what I would do. I would definitely measure first. Can thyroid issues cause bad headaches? After I moved, I can't get a doctor to treat me properly. Yeah, they can. Thyroid issues can cause horrendous headaches. One of the biggest types of headaches thyroid conditions can cause is a musculoskeletal headache. Low thyroid will cause muscle tightness, and it can create occipital tightness across the base of the skull and lead to a lot of excessive pressure coming down, leading to headaches. So yes, it definitely can create a headache. Okay, great question. Gabriella says, I have anemia, recurrent sinus infections, and Hashimoto. Last year I took a huge course of antibiotics due to sinus infection. What can I do about the anemia? Well, it depends on what kind of anemia. I'm going to assume you mean iron deficiency anemia, but I don't want to make that assumption. So clarify, because there are different kinds of anemias. But I would say with sinus infections, especially recurrent sinus infections, there's a great study done in the Journal of American Medical Association that found that more than 90% of recurring sinus infections were not bacterial induced. And so a lot of doctors just give an antibiotic. They say, oh, you have a sinus infection, here's an antibiotic. But it's actually not a bacterial infection. It's a fungal infection. The fungus, yeast, can infect your sinuses as well. So if you're taking an antibiotic, you don't actually treat an infection if it's not bacterial. So if it's fungal, you make the fungal infection worse. And this is what typically oftentimes happens. It's a pattern I see in people all the time. They've been to ENT specialists, they've been to GPs, and they've been on recurring antibiotics because of recurring sinus infections, when in fact nobody ever did a culture on them. Nobody ever clarified whether the infection was bacterial or fungal, and so they just were throwing an antibiotic at it. So again, clarity, you want to ask your doctor to run a culture when you go see them. Don't just take the antibiotic without them running that culture too, unless your life is in jeopardy and you're running 104 fever and they're extremely certain that the likelihood that it's a bacterial infection, and if you don't get the antibiotic, it won't save your life, right? But if it's just a chronic infection, you want to have that culture done so you can discern whether or not you've got a fungal infection versus a bacterial infection. Yeah, Luann, she says I put Quest MCT oil powder in my coffee. I noticed it says corn fiber on the label. Should I be concerned? You absolutely should be concerned, Luann, if you're gluten sensitive or if you're corn allergic. But the other issue there is GMO. I mean, 99% of the corn, I don't know if 99%, but close to 90% of the corn in the U.S. is genetically modified, sprayed with glyphosate. You don't want that in your coffee at any rate. So, yeah, a lot of you, I can see here, you need to get no grain, no pain, because a lot of you are realizing for the very first time that corn can be a problem. Look, when I say get your copy and read it, it's because there's a certain amount of fundamental information that I want you to have when you tune in on Monday evenings. It's critical that we all start from the same premise. When I'm talking about gluten-free, that we're talking about the same gluten-free. We're not talking about their gluten-free versus this gluten-free. We're talking about gluten-free based on the information out of No Grain, No Pain. Let's see here. So B8, how much biotin should you take a day? Well, it depends. If you're deficient in biotin, it can take 16,000 micrograms a day to get a good correction, and that can take up to 6 months. So it just depends on whether or not you're deficient. Okay. I love it. Tracy says, test, don't guess. That's exactly right, Tracy. I can tell you've read my book. I can tell you've listened in. Sally says, can allergy tests be inaccurate? 10 years apart, had several, now none. Yeah, they can be inaccurate, and it depends on the allergy test that you run. And also understand that there are 7 different ways that we know of that people can have an allergic response to food or environmental chemicals or anything for that matter. And most doctors, when they run an allergy test, they're measuring one of those 7 reactions, not all of them. And when they're running the test, they're also not measuring a lot of different foods. They're maybe measuring a handful of different foods. So part of the inaccuracy is the limitation on how many foods or how many chemicals they're measuring, and part of the limitation is what chemicals they're actually measuring, what antibodies and what other immune responses that are actually being measured. So yes, they can be inaccurate, but if they're done properly, they're highly accurate and can be extremely helpful in recovering from chronic illness. Okay. So yeah, Jenny Ramos came in late. She's asking what the name of the book is. Maxine, thank you for answering. It is No Grain, No Pain. You can pick up a copy at nograinnopeinbook.com. If you go there to order it, you can get a bunch of free bonuses. So that's what I recommend that you do, is wherever you buy it, whether it's Amazon or Barnes & Noble, is take your receipt number and go to nograinnopainbook.com and plug in your receipt number, because what we'll do on the back end of that is we'll send you some free gifts and some free additional information that'll help you use the book even better. Okay, let's make sure we're not ignoring the other folks here. Okay, so another question, is coffee okay to drink on a gluten-free diet? I have not had it in a very long time, but would like to. Man, I need to do a whole show on coffee one of these times. Matter of fact, I think we'll do that. But the simple answer is yes, coffee is gluten-free unless many of your instant coffees, the kind that with the powder, and you pour the powder in the cup and pour the hot water in and you stir it up, a lot of those will contain fillers that are grain-based. So you have to be really, really careful about instant coffees. The other issue is you got to be careful about cross-contamination depending on who's making the coffee. If you're grinding your own bean at home and you're not also grinding grain-based products in that grinder, then there's probably not going to be any gluten cross-contamination. And from the gluten perspective, coffee is just fine. However, many people with gluten sensitivity who use coffee know what coffee is. Coffee is a legume. Okay, and legumes have lectins and other things that are harder to break down and process and digest. So if your gut is already deteriorated as a result of being gluten sensitive and having years of gluten-induced damage, coffee may not be the best drink for you right now. Coffee may be a greater challenge than what your GI tract can bear. And some of you too, with chronic illness and chronic inflammation, the caffeine itself is overburdensome and can create additional problems. So caffeine can be a stimulant, and if you've already been overstimulated for years, meaning your adrenaline levels are already too high because of chronic illness, caffeine can delay or slow down the healing process. And so again, coffee being a major source of caffeine can sometimes be a problem. But as far as whether or not coffee contains gluten, no, it does not, unless of course you're buying one of these instant brands that have a gluten-based filler. So good question. Okay, I think we are gonna wrap it up. Hey, before we part, a couple of different things to remember. Number one, make sure you subscribe to our YouTube feed, youtube.com/glutenology. Make sure you go over to glutenfreesociety.org, and sign up for our newsletter and our free gluten-free survival kit. It's going to have a lot of great information for you, help navigate the gluten-free diet without making all the pitfalls and mistakes that so many people make and really, really struggle to try to get better. The other thing I want you to do, if you know someone who can be helped by this information, share in the mission. Our mission, you're part of my mission, so we're in this together. We're trying to help 100 million chronically sick people. Maybe you've already been helped by me, and maybe it's your turn to give it forward, to pay that forward and help somebody else. So make sure you're sharing this information with more people. The more we share, the more we can pay it forward, the more people we can help in this world. I will see you back next week for another episode of Pick Dr. Osborne's Brain. If you've got topics you'd like to see me cover, I'm open ears. We want your ideas. We want what you want to hear. In essence, help me help you. If there's a topic you'd like to see covered that hasn't been covered, or if there's something you'd like more elaboration on, please email us glutenology@gmail.com with those topic requests. Have a great evening. We'll see you next week.